Hi, I'm Dr. Sukhpreet Kaur, working as a consultant pediatrician and neonatologist at Cloudnine Hospital, Ludhiana. In a case of oversupply of the breast milk, we can do three things. First of all, while during the breastfeeding, we can use different positions, and those are like in the sideline position, in the semi-reclined position, and in the semi-prone position, and the seated straddle position can also be used. Second is like in such kind of the cases, we can use the nipple shield that will prevent the overflow of the breastfeed, and choking will be prevented in those cases. And the third thing we can do that, like prior to the breastfeeding, we can go for the some expressions by hand or by the pumping for 5 minutes, and then we can latch the baby, and it will be easier for the baby to latch in those cases. In a case of like how to control the milk flow in these like cases of oversupply of breast milk, first of all we can go for the nipple stimulation. What will nipple stimulation will do in such cases, that it will do the milk ejection. So spraying of the milk can be removed by the towel, and then when the breast is like a slightly softened, and then we can latch the baby on, and baby will be latching very easily in this case. And the second thing is like some studies are there that the block feeding can also be tried. But is block feeding in these cases, like we have to go for the breastfeeding from one part of the breast, from one breast only, and like at 2 hours, 4 hours, 6 hours. And then the other breast is like to release the pressure, we can go for the pumping but not emptying the breast. So like the block feeding is like we can go for the breastfeeding for one breast only, that can also remove the excess milk flow from the breast. And the third part is like sometimes like both the breast is like being emptying, and then after that block feeding is being done. So in many cases like we are using these kind of the methods, and in very rarely we use some kind of drugs like oral estrogen was tried and pseudoephidrine was also being given, but like we're using these things very rarely.